Today we're going to be talking about nurse burnout, but of course you have to know what that means. Nurse burnout is defined as a state of emotional, physical, and mental exhaustion caused by prolonged stress. The biggest factor in burnout is stress. Prolonged stress is typically caused by the number of patients that a nurse has to deal with. Nurses who are assigned to too many patients must juggle multiple tasks at once, leading to physical exhaustion and mental strain. Another factor is lack of sleep. A study found that 29% of shifts worked by nurses with under 6 hours of sleep raised error risks. There are many things that people aren't aware of that really impact nurse burnout. And one of the major factors include increased turnover, meaning nurse burnout is correlated with higher turnover, adding to stress to an overworked environment. Another factor is reduced quality of care, meaning that nurses usually don't take good care of themselves because they're worried about taking care of others. One study links nurse burnout to higher rates of urinary tract and surgical site infection. More impacts include COVID-19. COVID-19 played a huge factor in nurse burnout. 44% of nurses had an extremely disturbing or traumatic experience due to COVID-19. Another impact is workplace abuse. This could mean emotional, physical, and verbal abuse. Another big aspect that people don't think about is the job. Documentation, administration, patient load, and salary and work balance is all a huge factor in nursing. Another impact is their feelings. 75% feel stressed, 86% feel frustrated, 67% feel exhausted, 62% feel overwhelmed, 58% feel anxious, and 51% feel overworked. Think about all those emotions and how many nurses constantly have to deal with that every day. Did you know that 1 in 3 nurses report inadequate staffing levels? Or did you know that 2 out of 5 units are short-staffed in a facility? 54% of nurses report excessive workloads, and 96 out of 100 nurses report fatigue at the beginning of their shifts. Or maybe did you know that half of nurses say that they spend an insufficient amount of time with a patient? The worst part is that 44% of nurses have sleeping disorders, 25% have depression, and 25% get anxiety from their job. Nurses who work shifts longer than 8 to 9 hours were 2.5 times more likely to resign and experience compared to regular shifts. There's not just an impact on nurses, but also the patients. This can impact more medical errors, longer wait time for patients, decreased quality care of patients, and the worst of all, higher mortality rates for patients. Solutions to prevent nurse burnout are to better nurse-to-patient ratio, and also reasonable working hours and breaks for nurses, mental health support for nurses, higher wages for frontline workers, and support from administration and the public. So don't forget, next time you see a nurse, always say thank you for their service. Thank you for watching this video.